I am Dr. Alok Misra, practicing gastroenterologist in Allahabad. I would like to tell you something about hepatitis B and hepatitis C. These two viruses are very important. They are important because they predominantly affect the liver, and ultimately they will lead to chronic irreparable damage to the liver. So liver fibrosis, liver cirrhosis, and ultimately liver cancer may occur, and it may cause mortality, and it is a very important cause of morbidity and mortality in general population. Hepatitis B and hepatitis C both can be transmitted through three ways. One is through infected blood, another is from mother to his child, her child, or through sexual route. People who use infected razors, infected sharp instruments, IV drugs, or infected blood, undergone the surgery in unsafe environment, they can get hepatitis B. A child born to hepatitis B or hepatitis C positive mother, he also gets chances of acquiring hepatitis virus. Similarly, if one of the sex partner is infected, the partner can also get infection from his infected partner. Hepatitis B and hepatitis C, both viruses are very important. Their importance is basically because when they become chronic, and once they become chronic, it is very difficult to eradicate from the body, and they will damage the liver. They will continue to damage the liver cells, and ultimately a condition of liver cirrhosis occurs, which is by definition irreversible. Though with the treatment nowadays we can repair, we can revert back some extent, but it is a disease which is end-stage liver disease, and ultimately patient dies, and it can also lead to liver cell cancer. There's certain population of people who are more prone to get these infections, especially those who are the family contact or sexual contact of an infected person, those who are using IV drugs, those who are requiring repeated hospitalization or blood transfusion like hemophilics, hemodialysis patients, and also definitely the child who is born to an infected mother. Healthcare providers like doctors and nurses, they are also very at high risk because of they work in an environment which is filled with hepatitis B and hepatitis C positive patients. Hepatitis B and hepatitis C causes several clinical situations. Majority of the persons are having no symptoms. They are walking just like a normal person, and if you get them tested, then you can know that they are having hepatitis B or hepatitis C infection. But they are walking around in the population just like any normal person. But they are harboring the virus, and this virus is slowly and silently killing their liver cell. Another form of disease is, especially with hepatitis B, when there is acute insult. Patient gets the infection and he had the jaundice. Similar, just like any jaundice, where he had the fever, nausea, vomiting, flu-like symptoms, and eyes become yellow. But this form of disease, which is acute hepatitis, usually resolves easily. But the most important and dangerous is chronic infection. When in fact virus remains in the body for more than 6 months, it remains inside the liver, slowly damages the liver, and ultimately patient becomes cirrhotic. And these patients presents like an ascites, like fluid in their abdomen. They present with a vomiting of blood, they present with a large spleen, or they will present as a altered sensorium unconsciousness. So these are the symptoms which why these patients can present to a doctor. Before cure, it is important that we should prevent the spread of hepatitis B and hepatitis C. Once we know how hepatitis B and hepatitis C is spread, it is very easy to prevent their infection. First, People should practice safe sex. A child who is born to an infected mother should get vaccination, and hepatitis B immunoglobulin should be given to the child. All infants should be vaccinated against hepatitis B. All those who are at high risk should also be vaccinated against hepatitis B. And also people should not use infected blood, infected needles, syringes, tattooing, razors, toothbrushes. But these are vaccinations is available against hepatitis B only. Unfortunately, for hepatitis C we don't have vaccine. But if we practice safe sex, no use of contaminated needles, razors, sharp instruments, then we can prevent hepatitis B as well as hepatitis C. For treatment of hepatitis and B and hepatitis and C, treatment is now available. As far as acute hepatitis B is concerned, there is no need for treatment. Why? Because in acute hepatitis B stage, hepatitis B is usually self-limiting disorder, except few cases when there is a complication. But by and large, patients don't require treatment. The treatment is required only when infection becomes chronic, that is more than 6 months. In that case, for hepatitis B as well as hepatitis C, effective treatment is there in the form of injections and in the form of tablets. For hepatitis C, even the acute phase treatment is also recommended, but not for hepatitis B, except in a serious cases of hepatitis B. But for chronic, definitely treatment should be given to deserving patient, those who are in a stage of treatment. Though before deciding the treatment, several investigations has to be done. It is a complicated treatment, complicated algorithm, but once patient has given the treatment, response rate for hepatitis B is though not very high, but hepatitis C is very high, especially in Indian condition. But all the patients who deserve, who require, should be given the treatment, and it is a rewarding treatment. A person who is having hepatitis B and hepatitis C infection, to prevent further damage, first thing is treatment should be started, and apart from treatment, a routine healthy lifestyle should be advocated. They should not gain the weight, obesity should be controlled, they should have high dose with vitamin D intake, and of course they should avoid taking alcohol and other drugs which can cause harm to the liver, especially those herbal preparations. For them there is no information whether they can harm the liver or they improve the liver. So you should always avoid taking drugs. For them there is no information. A person who is having hepatitis B or hepatitis C infection, he can do his all works. He can participate in all social activities, he can have his family, he can work in any environment, except he cannot donate the blood. And of course there are restrictions for doctors who are having hepatitis B and C, especially replicative and high viral load in them. For them there is a restriction for performing some procedures, but otherwise for a general population person, he can do all his activities, all his lifestyle, except they cannot donate the blood.